Okay, I'm walking in and I'm closing the door for patient privacy after I just washed my hands. Hi, my name's Rachel and I'll be your nurse today. I'm here to give you a head-to-toe assessment just to get a general idea of your current health status. Is that okay with you?
Yes.
Okay, and would you mind telling me your name and date of birth?
Josh Mubarak, 4382.
Okay, great. And do you know what the date is today?
Yes. May 5th, 2022.
Okay, and do you know where you are?
Yes. I'm at home.
Okay, and do you know why you're here?
Yes. I'm getting a physical done.
Okay, so patient is alert and oriented ×4. He's a 40-year-old Caucasian male. He is well-groomed, dressed appropriately for the season, well-nourished. His body build is appropriate for his age and sex. Prior to this exam, we took his height and weight and BMI, which is all appropriate for his age and sex. We also tested his cranial nerve 2 using the Snellen test. His vision is 20/20. He has no difficulty hearing. He is ambulatory, walks with a normal gait. His posture is erect. He is cooperative and maintains eye contact. Are you experiencing any pain today on a scale of 0 to 10, with 10 being the worst pain?
No, 0.
Okay, so patient states no pain at a level 0. Okay, let's go ahead and get, and his skin color is appropriate for ethnicity. Okay, let's go ahead and get started. First, I'm going to start by palpating your scalp. Okay, skull is symmetrical. Texture and hair distribution is normal for age and sex. And his hair distribution is normal for sex. No obvious infestations such as lice. Hair quantity is appropriate for age and sex, no balding. Okay, so now I'm going to go ahead and palpate his temporomandibular joint, his TMJ, if you wouldn't mind opening and closing for me. Okay, his joint moves with ease, no obvious crepitus, pops, or clicks. Now I'm going to palpate your frontal and maxillary sinuses and as well as your facial bone. Just let me know if you feel any pain or tenderness. Okay, no pain or tenderness noted. Facial bone is symmetrical. Now I'm going to take a look at your eyes. No inflammation or redness. Sclera is white, no jaundice. If you wouldn't mind pulling down your eyelid for me. Okay, conjunctiva is moist and pink. Iris is blue. Okay, and so I'm going to test cranial nerves 2 and 3, your optic and ocular motor nerve. So if you wouldn't mind just looking straight ahead. Okay, and look over my shoulder and follow my pen light in. Okay. Pupils are equal, round, and reactive to light and accommodation, as well as direct and consent. Yeah, he responds appropriately to direct and consensual light. Now I'm going to test cranial nerve 2 with the vision fields. So if you wouldn't mind covering one eye. Okay, and now just let me know when you see my fingers wiggling in your peripheral vision.
Yes. Yep. Yep.
Okay, and other side.
Yep. No. No.
Okay, so cranial nerve 2 is intact. With the previous test before accommodation, direct, and consensual, his cranial nerves 2 and 3 were also intact. So now I'm going to test cranial nerve 3, the corneal light reflex. So just go ahead and look straight ahead. Okay, light is equal in both pupils. Pupils are symmetrical. Now I'm going to test cranial nerves 3, 4, and 6, the ocular motor, trochlear, and abducens. So go ahead and just follow my pen light just with your eyes. Okay, cranial nerves 3, 4, and 6 are all intact. Now I'm going to take a look at your nose. I'm going to palpate your nose. Okay, no masses or nodules. Nose is midline, no deviation. Nares are oval and symmetrical. So go ahead and tilt your head back, and I'm going to take a look at your nose. Okay, mucosa is pink, moist, and intact. Now I'm going to take a look at your ears. Okay, color is appropriate for ethnicity. Ears are symmetrical bilaterally and even. His external auditory canal is intact and no nodules present or lumps or masses. Now I'm going to take a look at your mouth. Lips are symmetrical vertically and horizontally. Would you mind opening your mouth for me? Okay, teeth are present and securely attached. His gums, tongue, and buccal mucosa are all pink, moist, and intact. His tongue is midline and symmetrical bilaterally. No lesions or masses noted. Will you open your mouth again? Okay, and his mucosa of the pharynx is pink, moist, and intact. Now I'm going to test cranial nerve 12, the hypoglossal nerve. Would you mind sticking out your tongue and moving it side to side? Okay, cranial nerve 12 is intact. Now I'm going to test cranial nerves 9 and 10, the glossopharyngeal and the vagus nerve. Would you mind opening your mouth and saying ah? Okay. Soft palate uvula rises and is midline, so his cranial nerves 9 and 10 are intact. Now I'm going to test cranial nerve 7, the facial nerve. Would you mind smiling without your teeth? Smiling with your teeth? Okay, frown. Puff out your cheeks. Okay, cranial nerve 7 is intact. Now I'm going to test cranial nerve 5, the trigeminal nerve. So what I'm going to go ahead and do is brush this against your face, and it feels like this, and then just let me know when you feel it. Close your eyes.
Yep. 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 Yep.
Okay, cranial nerve 5 is intact. Now I'm going to inspect your neck. Okay, would you mind tilting your head back and swallowing for me? Okay, trachea is midline. His thyroid gland is not enlarged. And now I'm going to palpate your lymph nodes, starting with the preauricular. Let me know if you feel any pain or tenderness. The postauricular, the tonsillar, the submaxillary, the submental, the posterior cervical, the deep cervical, and the superficial cervical, as well as the subclavicular. Okay, lymph nodes are not palpated, no tenderness or pain noted. Now we're going to test some range of motion strength exercises of your neck. Would you mind going side to side? Okay, now look up and look down. Okay, so now we're going to test your strength. So go ahead and look down and don't let me push your head up. Okay, and go ahead and look back. Don't let me push your head back. Okay, great. Strength is 5 out of 5 and full range of motion of the neck. So now I'm going to palpate your carotid arteries one at a time. Okay, carotid arteries are 2+ bilaterally. Now I'm into your carotid arteries using the bell. Okay, no bruits noted. For your hair, your texture was normal. I think I said that. Okay. Oh, and no ptosis noted for your eyelids. No edema noted either. Okay. Oh, and oh, okay. So now I'm going to test cranial nerve 11. So if you wouldn't mind shrugging for me, the spinal accessory nerve, and now I'm going to try to push down. Okay, great. The cranial nerve 11 is intact. Would you mind closing one nostril and breathing in and out? I'm going to test your patency, and now close the other one. Okay, no obstructions noted. Now if you wouldn't mind closing one ear and kind of wiggling it, and I'm going to whisper 3 words into your ear. Car, tree, light. Please repeat that.
Car, tree, light.
Okay, and the other one? Blue ball boat.
Blue ball boat.
Okay, great. Cranial nerve 8, the acoustic nerve, is intact. So now I'm going to go ahead and assess your upper extremities. Okay. Muscle mass is symmetrical bilaterally. Skin color is appropriate for ethnicity. Okay, temperature is warm, skin is dry, hair distribution is symmetrical and even, appropriate for age and sex. Nails are pink and smooth. Now I'm going to check for capillary refill. Okay, capillary refill is less than 3 seconds. Now I'm going to check your radial and brachial pulses. Okay, pulses are 2+ bilaterally. So now we're going to test some strength and range of motion exercises. So if you wouldn't mind holding out your hands and opening and closing, like your fingers. Yeah. Okay, great. And now squeeze my hands. Okay, great. And now hold your hands up and now put them down. Okay, now don't let me push them up. Okay, now put them back up and don't let me push them down. Okay, great. And now if you'll bend your elbows and now extend them. Okay, great. Now bend them again. Don't let me push down. Don't let me push up. Okay, great. And now if you wouldn't mind reaching up overhead, don't let me push out. Don't let me push in. Okay, great. Full range of motion and strength is 5 out of 5. Okay, so now I'm going to inspect your back. Okay, so I'm going to palpate his spine. Okay, no curvature noted. I'm going to palpate your scapulae. Okay, so your shoulders, scapulae, and thoracic is symmetrical bilaterally. Your muscle mass is appropriate for age and sex. And no lesions, your skin is intact. Now if you wouldn't mind, I'm going to put my thumbs at your 10th rib and take a deep breath in for me. Okay. Okay. Thoracic expansion is even and symmetrical bilaterally. Okay, so now I'm gonna listen to your lungs. So every time you feel my stethoscope move, just go ahead and take a deep breath for me. Deep breath. Okay, now I'm gonna listen to your lungs on the front. Okay. Breath sounds are even, no adventitious or diminished sounds heard. His respiratory rate is within normal limits at 16 breaths per minute. His breathing and his respirations are unlabored and quiet, no accessory muscles used. Okay. And now I'm gonna just take a look at your chest. I'm gonna palpate your chest. Skin color is appropriate for ethnicity, and your pericardium. Okay, no masses or nodules noted. His pericardium is midline. Okay, okay, so now I'm gonna locate your PMI. Okay, PMI located, no pulsations. Now I'm gonna go ahead and auscultate your heart. Starting with the aortic, pulmonary, the Erb's point, the tricuspid, and the mitral. Okay. S1 and S2 were heard throughout. Now, if you wouldn't mind laying down for me. And kind of lay on your left side. And I'm gonna listen to your heart again. Using the bell. I'm gonna start at the mitral, tricuspid, Erb's, pulmonary, aortic. Okay, no murmurs noted. You can go ahead and lay flat now for me. I believe I said no thrills, heaves, or lifts noted for his chest. Okay, great. So now I'm going to take a look at your abdomen. Skin color is appropriate for, just go ahead and lay normal. Skin color is appropriate for ethnicity. Contour is flat, no pulsations noted. Now I'm going to listen to your bowel sounds. In all four quadrants, starting with your lower right, upper right, upper left, lower left, Okay, so normal active bowel sounds heard in all 4 quadrants. Now I'm going to palpate your abdomen lightly. Just let me know if you feel any pain or tenderness. Okay, no pain or tenderness noted, no masses or nodules. Okay, so now I'm going to take a look at your lower extremities. Okay. Skin is warm, dry, and intact. Muscle mass is appropriate for age and sex and symmetrical bilaterally. Hair distribution is normal and even. And now I'm going to palpate your pulses, starting with your dorsalis pedis. Okay, your posterior tibial. And now your popliteal. Okay, pulses are 2+ bilaterally. Now I'm going to take a look at your capillary refill. Okay, capillary refill is 2+, capillary refill is less than 3 seconds. Now I'm going to do some range of motion and strength exercises. So if you wouldn't mind wiggling your toes for me. Okay, now put your toes up and down, both toes. Okay, and now push your feet like you're pushing on the gas pedal. Okay, and now up, all the way up, your ankles. Push your feet back, okay? And now don't let me push down. Okay, now put them down. Push on the gas pedal. Don't let me push up. Okay, great. And now if you wouldn't mind bringing your knee to a 90-degree angle. 90-degree angle. Okay? No, 90-degree angle. Now don't let me push up. Okay, now don't let me push down. Okay, now the other one. Okay, 90-degree angle. Okay, don't let me push up. Don't let me push down. Okay, great. And now put them down. And now if you wouldn't mind swinging this leg out. Okay, don't let me push in. Don't let me push out. Okay, the other leg. Don't let me push in. Don't let me push out. Okay, great. Strength is 5 out of 5. He has full range of motion. Okay, so now if you wouldn't mind getting into a seated position. Like how you started. Okay, great. Patient moves to a seated position with ease of movement and coordination. Okay. Okay, so, and I'm gonna check for pitting and edema when I checked your legs. Okay, no pitting or edema noted on the lower extremities. Okay, so now I'm gonna test your sensory functions. And so I'm gonna go ahead and test on your lower extremities and your upper extremities. So I'm gonna let you know what this feels like. First, this is sharp, and this is dull. And so now close your eyes and let me know whether you feel sharp or dull.
Dull.
Okay.
Sharp. Dull. Dull. Sharp. Sharp. Dull.
Okay, and now I'm going to draw a letter on your hand and just let me know what letter I draw on your hand. Close your eyes, please.
T.
Okay, great. His sensory function is intact. Now I'm going to check your fine motor and coordination. So if you wouldn't mind putting each finger to your thumb. Okay, now the other way. A little bit faster. Okay, great. And now I'm going to put my finger out and touch your finger to your nose and then touch it to my finger as I move it, okay? So put your finger on your nose, okay? Okay, now back to your nose. Okay. Okay, his fine motor and coordination is intact. And now I'm going to test your patellar reflex. So just let your, just relax and let your legs dangle. Okay. Okay. His patellar reflex is there. It's not exaggerated or diminished. Okay, so now, if you wouldn't mind standing for me. Okay, now bend down. Okay, I'm going to palpate your spine again. Just let me know if you feel any pain, tenderness, or pain. Okay, no curvature of the spine noted and no pain or tenderness. Okay, if you wouldn't mind standing up for me. And lean back for me. Okay, and now if you wouldn't mind twisting. Okay, you can lean up now. Okay, and now twist to the right and to the left. Okay, and now go to the side laterally. Okay, he has full range of motion of the back. And now I'm going to test your balance using the Romberg's test. So if you wouldn't mind just closing your eyes and staying still for 20 seconds. Okay, great. Your balance is intact. 20 seconds has passed. Now if you wouldn't mind taking 6 steps forward. Okay, now turn around and walk back heel to toe. Walk back heel to toe, checking your balance. Okay, great. Balance is intact. I think this is my 4th and final time to look at this. That was your gait test. Okay, great. Do you have any questions for me? No? Okay, well, thank you so much for your time. You are healthy.
Thank you.